Educating patients is very important. Before surgery, I educate them about the surgery, what to expect, what not to expect, and the complications. And sometimes the complications will scare them to the point that they'll say, well, maybe I'll hold off and not do the surgery. And I tell them that's okay, unless it's something that's very urgent, like an airway obstruction or, say, a cancer that we need to do something with. Then I'll try and talk them back into the surgery. Otherwise, I'll say, okay, then you think about it. They'll either say, okay, let's go do our surgery, or I'll come back after I think about it. Many years ago, when my son was a little baby, he had a urinary tract infection. It was very frightening, and so we were at the hospital in Chicago, the Children's Memorial Hospital, and none of them could put an IV in. But I was very, very good at putting IVs in, so I put my IV in my son. And I realized, then, how hard it was to do that on your own son and someone who you know and love. And so from then on, I became much more careful with children and adults doing things on them because I knew how frightening they were. I think when a patient first comes in and they're not quite sure what they have, there's always an unknown. A lot of patients will come in with very minor complaints, but their fear is that of cancer. And once you do a full examination and tell them that they don't have it, they're very relieved. You can see in their eyes and the fear when they're talking about a mild sore throat, what they're thinking about. And then at the end of the interview, in examination, when you talk to them about what you're finding is, then I often ask them, did you have a fear that you had cancer? And almost invariably it's yes.